Hi, my name is Alexandra Bryant, and this is my Vet 122 GI series radiographic video. Indications for GI series abdominal RADS include vomiting, diarrhea, constipation, hematochezia, melanina, abdominal mass, abdominal pain, foreign bodies, or post-abdominal trauma. Contradictions include special studies that shouldn't be performed if the patient has a fluid-filled distended esophagus or stomach, or if the bowel is atonic. In addition, patients with ileus due to torsion or other conditions are not ideal candidates. As I demonstrate in this video, I administer one large orange BIPS capsule orally into my dog Bane's mouth. I followed the BIPS capsule administration with an oral syringe full of room temperature tap water to help ensure Bane actually swallowed the capsule. Bane was fasted roughly 4 hours prior to the BIPS administration. After 15 minutes, I obtained a right lateral abdominal view radiograph. I was not looking for anything or concerned about anything in particular with Bane, but he does have a history of getting into just about everything, so I figured a foreign body GI obstruction is always a possibility. BIPS are easy to administer, not likely to be aspirated, and can be given with food. Survey radiographs obtained prior to the contrast study help determine proper exposure, patient prep, and may also potentially eliminate the need for contrast media altogether. The vet will select the contrast agent based on the patient's tolerability for fasting and sedation, the suspected problem indicated by the survey radiographs, the uses of the various contrast agents, and indications, contradictions, and side effects. 2 perpendicular views, a right lateral and a VD, are typically required of the patient's entire abdomen. The time the radiographs are obtained is not critical, however, the time elapsed between the administration of the spheres and when the images are taken is important to note and should be recorded on the radiographs. For abdominal radiographs, measure at the thickest part of the TL junction. Center caudal to the 13th rib in the dog, or 2 to 3 finger breaths caudal to the 13th rib in the cat, including cranially from the T9 for the VD view and the T7 for the lateral views, and caudally to the acetibulum. For positive contrast studies, make sure you set your kVp about 6 to 8 kVp higher. Ideally, you want to have someone helping you take these radiographs because most patients won't be as good as my dog, and you will see how I struggle here anyway. So while you watch this miserable part of my video, I will list the pros and cons of each contrast agent. 4. Oral organic iodine ionic solution used for suspected intestinal perforation and obstructures. The pros include rapid transit time, non-irritating to the mucosal surface. It's readily absorbed from the peritoneal cavity. If there's leakage, it can be absorbed across the mucosa and exerted by the urinary tract. The cons include its bitter taste, it's expensive, its hypertonicity can cause fluid movement into the lumen, dilution of the contrast medium, electrolyte imbalance, dehydration, nausea, vomiting, and decreased blood pressure. For organic iodine ionic solution, the IV is less vicious. Its hypertonicity affects more likely to occur after rapid IV bolus. It's irritating to the brain and the spinal cord and can cause toxicity and tissue irritability. Organic iodine non-ionic solution, which can be given by mouth or IV. It's used for myelography. It can be used for IV, especially for young patients who are debilitated. Its pros include fewer side effects than ionic form rapid transit time. It's non-irritating. It's reabsorbed after extraluminal leakage. It does not become increasingly dilute. In ultrasound and endoscopy, it will not be impaired in a contrast study if it's first completed. Its only major con, is that it's expensive. For radiopaque markers such as BIPS, which are given by mouth, in addition to the pros I listed earlier, the other pros include time frame for radiographs are not as important. They do not obscure abdominal details. They're more likely to detect motility disorders. The cons is that you cannot visualize mucosal detail and luminal margins. They're expensive compared to the barium suspension, and studies can take longer. Last but not least, in comparison to BIPS, barium sulfate suspensions, which are used for routine GI contrast studies rectally or orally, they are not used if GI perforation is suspected. The pros include low cost. It detonates the mucosal walls well. It's excellent opacity. It remains in suspension. It doesn't become dilute with secretions. It does not absorb through the intestines, and it has good density. Some cons include it is slow to be transmitted and very messy. It's insoluble, so you cannot use it with perforation. And aspiration in lung can be fatal. It's very irritating to the peritoneum. The formula for gastric emptying with the use of BIPS includes: first, you count the number of the BIPS that the animal has left in the stomach. Secondly, you want to calculate as follows: the number of BIPS that the animal has left in the stomach divided by the total number of BIPS seen on the image, and multiply that by 100. Then you will get the percentage of BIPS that the animal has left in the stomach. The formula for orocolic transit time: first, you want to count the number of BIPS that are in the colon and calculate it as follows: the number of BIPS in the colon divided by the total number of BIPS seen on the radiograph times 100 gives you the percentage of BIPS in the colon. Remember to calculate the small and large spheres separately. The total number seen on the image will be a maximum of 10 large and 30 small spheres. Apply this percentage to the appropriate chart. The gastric emptying time of normal animals varies greatly. Factors such as the effect of medication and the type or volume of meal given also alters the times. Low dosages of barium may delay emptying and transit time because the stomach empties slower when there is less volume in the stomach. Delay may also occur in nervous animals that are stressed in the environment. On an upper GI barium sulfate study without any food, delayed gastric emptying is diagnosed when gastric emptying is not completed after 3 hours in dogs and 1 hour in cats. Gastric emptying time longer than 8 hours for barium mixed with solid food is considered abnormal. In procedures for positive contrast upper GI studies such as BIPS and barium, the cat's GI tract digests the barium almost 4 times faster than the dog's. Although several factors go into play, it can take up to 4 hours for the barium to travel through the upper GI tract in the dogs and only 1 hour in cats.